This is a story of people
who've devoted their lives to health and wellness.
People advancing the power of healing,
mind, body, and spirit.
People driven, as they've been for 100 years, by a mission.
It's our mission
to demonstrate God's care
by improving the health of people
and communities
through a ministry of physical,
mental, and spiritual healing.
Ellen G. White, an early Adventist leader, taught that people could enjoy better health and live longer through nutrition, exercise, and faith in God's Word.
In 1905, proceeds from her book, The Ministry of Healing, were used to buy land in Tacoma Park.
And after giving her blessing to the site, construction began.
On June 13, 1907, the Washington Sanitarium, or SAN as it was called, opened its doors.
The 14-acre parcel was ideal, with fresh air and pure water, and isolated from busy city life.
It was here that whole person care became a reality, with 40 beds and a staff of 12.
The Washington Post wrote, "It would be difficult to find a better place for quiet and rest."
This hospital's first story of care belongs to the Cresses.
Dr. Daniel H. Kress was the hospital's first superintendent and surgeon, performing the first surgery here.
And his wife, Dr. Loretta Kress, was our and Montgomery County's first female doctor.
In 1916, she created a new ward exclusively for children and expectant women.
Before her retirement, she would deliver over 5,000 babies. I'm one of those babies.
100 years ago, Dr. Loretta Kress was advocating reducing risks for pregnant women
and pioneering better ways for mothers to take care of themselves and their newborns.
When the baby boom started, we were there.
We teamed with the Red Cross to introduce mother and baby classes.
In 1975, we began a parent education program
that, for the first time, invited fathers into the delivery room.
Helping bring a new life into the world, it gets me every time.
Today, we'll heal a heart.
We'll use the latest in cardiovascular technologies, from diagnostics and surgery to prevention and rehabilitation.
In 1962, a surgeon joined our staff and brought a broad vision. His name was Dr. Kenneth Cruz.
He presented a plan that would give the hospital a top-quality open-heart surgery program.
And before the decade was over, we had everything to make it a reality.
In 1971, our first open-heart surgery took place, an aortic valve replacement performed by Dr. Gene Abbey and Dr. Kenneth Cruz.
Dr. Keith Lingren and Dr. James Ronan joined our staff, and throughout the 70s and 80s, they built the cardiology department.
The backbone of cardiac and vascular programs that today are second to none in the region.
Since 1971, we've performed more than 16,000 open-heart surgeries
and 100,000 life-extending cardiovascular procedures.
Looking back, all that's happened and how it's happened, this program was truly blessed.
Today, we know in order to stay our best, to stay leaders, to save lives, we need to keep creating breakthroughs.
My name is Michael Alamu. In 1985, I had open heart surgery at Washington Adventist Hospital. I am proud to be part of the hospital's history.
From the beginning, our founders warned about the dangers of tobacco. But as smoking grew in popularity, it was a pulmonary specialist from Washington Adventist Hospital that led the charge to fight back.
In 1960, Washington Adventist Hospital's Dr. J.W. McFarland
developed a groundbreaking program that helped people kick the habit in just 5 days.
3 years before the Surgeon General's report linking cigarettes and disease.
The program has helped over 20 million people. And in 1974, Dr. Alfred Munzer, president of Washington Adventist Hospital's medical staff, began his work to fight secondhand smoke. Testifying before Congress, his efforts led to the banning of smoking on airlines.
Today, Dr. Munzer is involved in an international effort with the World Health Organization that sets the stage for a global fight against smoking.
The future of pulmonary medicine will see even more efforts to change public policy and attitudes.
On November 15, 2007, our campus will become 100% tobacco-free.
We never forget the importance of a simple breath of air.
Taking care of the community.
It's been our mission.
And it's been happening here since we opened our doors.
And continued as we vastly expanded the emergency department in 1966.
Mind, body, and spirit, it happens here 24/7.
We care for everyone who crosses our threshold. No one is turned away.
We are the safety net, and we are one team. The emergency physician, the physician's assistants, the nurses, and technicians.
In the last 15 years, this department has doubled. This year, we'll see over 42,000 patients.
We'll handle all kinds of care, from elder care, neurological, to heart problems.
Everything comes through those doors. Stroke, GI problems, neonatal emergencies, surgical problems.
We opened the first chest pain center in Montgomery County.
I can't imagine providing whole person care in a more important way. We're here for them at a time when they need it the most.
Everyone deserves access to health care, not just those who can afford it.
For 100 years, that's what we've been all about.
Our vision for expanded access is taking the idea even further.
Developing new relationships with the community, providing new services to more people.
Creating partnerships that meet healthcare needs in new ways.
We've created our Center on Health Disparities to address and eliminate barriers to health care.
And to provide education, research, and culturally sensitive healthcare services to the community.
Partnerships with various community-based organizations in our region are ways we're reaching out.
Providing the highest level of health care for everyone where it's needed.
The power of the Spirit has been at the heart of what we do since day one.
As a Seventh-day Adventist institution, we've never shied away from the power of faith.
Whether for its power to heal, to give comfort, to aid in understanding, or to be in awe of undeniable miracles, as well as give blessing to our outcomes.
Our faith has always been integral to our approach to care.
In 2002, we started our grief recovery program, helping families and caregivers to cope with loss.
Through support groups and bereavement services, the people of Washington Adventist Hospital have used faith to bring comfort to hundreds of people.
And today, faith joins science, using spirituality and prayer to aid in healing.
In clinical studies, the power of prayer has been shown to contribute to improved outcomes, as we have known from the beginning.
For 100 years, we've been practicing what the National Institute of Health today call frontier medicine.
Coupling science and medicine with the power of faith. Whole person care. It's not frontier medicine here. It's front line. Mind, body, and spirit.
This has been the story of Washington Adventist Hospital at 100 years.
It's a story of a century of compassion.
A century of the best of care.
The story of a hospital ahead of its time.
And as we did 100 years ago,
once again, we're going to build a hospital for the next century.
We know what it takes.
It takes passion and commitment to a mission.
A mission as meaningful today as it was in the beginning.
To demonstrate God's care.
By improving the health of people and communities.
Through a ministry of physical,
mental, and spiritual healing.
This
is Washington Adventist Hospital.
Mind, body,
spirit,
health.